right. Today I'm joined by Jolly Nanda, founder and CEO of Althea, the company behind AcuVIA, a platform designed to give patients full ownership and control of their health data. Jolly brings 2 decades of healthcare and life sciences experience, including her time at UnitedHealth Group, working on provider and payer data and services. They're tackling one of healthcare's biggest challenges, connecting the dots between fragmented data systems so both patients and care providers can see the full picture. So their mission is to make patient data usable, shareable, and actionable, all through a consent-driven model that puts the individual back in control. We'll unpack how AcuVIA works, what this shift toward patient owned data means for care management, and how value based organizations and digital health partners can use this to improve outcomes and efficiency. So, welcome, Jolly.
Thank you so much for having me, Scott. I'm glad to be here.
Absolutely, absolutely. And thank you. Okay, so, Jolly, what first inspired you to start Althea? And then how did your background shape the vision for AcuVIA?
So, after more than a decade at UnitedHealth Group, I really understood the complexity of healthcare. First of all, let's just put it out there. It's not easy. There's this push and pull between cost, quality, and the patient experience. And I saw mass data, like massive amounts of data, claims, clinical, behavioral insights, but very little context. So if you think about it, the data was about the patient, but not from them, right? And when I became a patient myself, I experienced how disconnected and frustrating the system felt and how hard it was to get, your records together and how invisible when you're a patient you feel, right? And that was a turning point for me. And I wanted to build a company that connected these dots and wanted to make healthcare data really personal. And Akivia is that platform to make that vision real.
So, you saw that there was a healthcare data problem. Like, what are some of the things? Maybe tell me more about what are you trying to fix or what's been broken?
Yeah. So healthcare data doesn't really tell the whole story, right? So it represents like a piece of the person. And our information is scattered into multiple health systems and they don't talk to each other. And even if they do, we know with TAFCA and, the electronic data exchange now, information is flowing, but often it is not usable data when it gets to the receiving system. But then there's also the context of the patient that gets missed. So, for example, if you're given a prescription and you decided that, okay, it's really not for me, and you stop taking it and you don't inform your healthcare providers, they never know that you're not on that drug, right? Or if you're taking supplements that could basically conflict with some of the prescriptions, if you don't tell them, they'll never know. But there's no way for the consumer or the patient to like just edit that in the system. And that is really the context, right? Where how you or where you grew up, right? The environmental toxins you were exposed to during that time, what you eat, what your lifestyle is, and all of that basically paints a picture of you. And when the provider is talking to you, they can't take into account, the whole you if they don't have that view, right? They only have like 13 minutes in the office room with you, right? They don't have the full context, and that's what we're trying to bridge.
So, for those new to this space, what exactly does it mean for a patient to own their data? And how does AcuVIA make that real?
Yeah. So the way that uh, patient data typically works is right now, you may have your data, like I said, with one system or the other. And if you want the data to move, you basically have to go to that one system or that one provider and request for your patient data and, request for that data to be sent, right? So it all works because you consented, right? That's how it works today. In the ER, it's slightly different, right? Because they can go hit the HIE and grab some data for you just so they can treat you. But
What is
otherwise,
the Sorry, what is it? HIE? Just for anybody who might not know.
Health Information Exchange, which
Thank you.
most states have. And sorry, I use all acronyms, but it's what is used to basically get urgent data if you're in the ER, because you only need a little bit of information to get started to triage the patient. But really, there's a lot missing, even in the HIE, because it has high level information. Now, if you had a platform where you could basically give consent and have all of that data brought in for you, and then you controlled all of that data. So that's just the medical. And you can have like your EOBs, you can have explanation of benefits, just so you know who you saw for what,
Yeah.
right? And it all kind of tied it together, all your visits, all of your after visit summaries that you usually get in the different EMRs. And what if then you were able to add context, and you were able to fill in all of your demographic information, you were able to put in all of your family medical history, you know, going back and as wide as you'd want, better than any genetic testing, because what it shows you is what are you susceptible to, right? If it runs in your family, because you may have a gene, but unless someone in your family has it, right, you don't really know if it's going to present itself in a certain way. So, past addresses, all of that information, whether you use, you know, your preferences, whether you like to cook your own food, whether you typically do takeout, all of that information is really helpful in not only diagnosing someone, but being able to then create a care plan. Because even if you like certain activities, have certain hobbies, if people were to create a care plan for you, they can customize it, right? Personalize it so you can actually follow it versus, oh, I want you to run 20 minutes a day. Oh, well, I hate running. There's no way I'm going to do that.
Can you share an example of how AcuVIA is already being used in a real world setting, like your work with a care management company
Yeah.
supporting Medicare practices, for example?
Yeah. Yeah. So, yeah, we are working with a care management company. And the way that AcuVia is used is, um, the patients basically use the platforms to gather all of their data, and then they consent for that data to run through the analytics or the AI models that we have. And they also then authorize, if they wish, for some of that data to go to care management. Some of them basically only authorize the risk scores for the various disease models that we have that end up with the care managers. Some of them give them access to the full record. And what that allows is that collaboration really to occur between the care manager and the patient. And it helps them keep track of the population that they're managing. And they're able to care managers then are able to prioritize, like, I see something, even though, it may not be a risk score changing, or it could just be something that they notice in the data that triggers them to reach out, right? So those are all really important. But the other thing is, with the consumer's consent, we can also create clinically validated outcome reports, because every encounter with care managers or providers is within the system. And so it can actually, over time, create all of the member level and population level outcome reports and provide some of the quality data that, programs like Medicare that are value based really need. But it also, provides that view to the consumer. So they can also see, what's working, what's not working for
Mm.
them.
Well, going into a little bit more on that, like, because you talked about outcomes, like what kind of outcomes or efficiencies have you started to see from those early use cases?
So I think, one of the outcomes from an efficiency standpoint from care managers is, like I mentioned, that they're able to, look at the patients that they're assigned, and they're able to prioritize. So they're better able to manage their queues for the day. And also, they're able to intervene when they see, like I mentioned, if they see a risk score rising because new data was entered. So especially if you're doing remote patient monitoring, with biometric data and wearables, data is constantly coming into the system. And so
Mm,
you can see what's changing and being able to react to that in a prioritized way. So we're not diagnosing, we're just triggering that the data has changed. But then
okay.
they can actually look at that and create the efficiencies in how they reach out.
And this is for people like, I mean, nurses, doctors, but people also that are maybe doing home visits and stuff that are, and then how are they, because you mentioned even wearables, like, are you seeing people to wear those and then is that, or is that kind of in the plan as potentially maybe people wear or have these wearables that are something that's reporting back? I'm just trying to guess, understand how that's feeding back into the system to alert
Yeah.
essentially the caregiver.
So Yeah. So, there's remote patient monitoring, which, the most providers or care managers put in people's homes and
Okay.
they have data coming in. But the patient is also able to access their own data because it's their data,
Okay.
right? So when they give consent, we're able to grab, that data as well,
Okay.
right? And then if the patient has some wearables, a lot of people have the Aura rings. A lot of people have, smartwatches. I'm not saying a lot of Medicare patients do,
Yeah.
but they do have, some sort of remote monitoring in their home. And a lot of care management companies put these monitors in their home so that they can actually engage with the patient. And we're able to get all of that data as well, because, like I
Mm.
said, it is consent based. So if it is for the patient and on the patient, then with the consent, it is accessible.
And then are the patients then going into and entering? Like, let's say if you have a device or something that, or if you want to make an update, you're going in and saying, "Hey, this happened today, or this was occurred," or
Yeah.
is it a
So there's
combination?
two levels, right?
Okay.
Where when we onboard a consumer or a patient, um, they have to enter some basic information. And then there's things that we periodically ask to, keep maintaining it in the system. So suppose you changed, how you prepare your food, or you change your diet, what you generally eat. You might want to keep that updated. So we send you reminders periodically to keep it updated. But when we originally designed the system, we were really targeting the self-funded employer group space to roll it out through a B2B2C model. And so some of the features, don't translate very well to Medicare population, but we noticed that the demand was more in the care space, and in some of the older population, or just a cross segment, right? And what we ended up having to do is allowing for either them to enter the data, and in some cases where Medicare patients, or there is a set of population that isn't comfortable with technology, they can ask someone else to enter it. The care manager can enter it. And we're adding additional features shortly in a roadmap to use a lot of voice. So the one thing that we've already added is, say, for consent, Medicare patients typically don't want to have to log in and provide that consent, but they can do it verbally and it's fully recorded. It's a video recording that is then stored and
Mm,
it is
as part
read
of the
to
consent.
them.
Mm,
They acknowledge that they understood it, that they're consenting. So it's
okay.
finding things that work for the population that you're working with that we're
Mhm.
trying to incorporate so it works better for everyone.
I love it. Okay. So you talk a lot about closing the loop between patients, clinicians, and data. What's one story that shows what's possible when that loop is finally closed?
Yeah. So I'll give an example where a patient struggled years with fatigue, joint pain, and then suddenly started having massive hair loss as well. And, um, you know, they were going to different providers, different specialists, and every encounter started from scratch, right? Because again, the data wasn't flowing, the context was missing. And so with AcuVIA, she was able to put all of her records together and the context and the supplemental data and started taking that. Well, you can send it as well, but we know that like I mentioned, if it's not usable in the receiving system, the provider doesn't really see it in the 2 minutes that they're walking room to room, getting your chart up on their laptop. So if you have this with you, then you can provide that data, while you're having this conversation. And what that allowed is for them to work through patterns that, the symptoms, the patterns that the patient was seeing, the photos of some of those symptoms, and then looking at the medication and the supplements. And what ended up happening was they really needed to adjust the medication and hold off on some of the supplements because they were counteracting with each other, right?
Mm.
So it's as simple as that. That is just the simplest use case that I can share with you,
Yeah, so
where it made a huge difference.
yeah, so it just sounds like the doctor was better informed. He had more information in front of him that would have taken maybe much longer time and potentially misdiagnosed or had to,
Correct.
made a different correction. But it sounds like he was better or he or she was better informed, right? So, okay, good,
Yeah,
good. That's
and
good.
that is one of the biggest challenges in healthcare today is misdiagnosis, and we've got annually 12 million Americans that are misdiagnosed.
That's scary.
It's a big number.
So, how do you see consent-driven data models like yours changing the future of care management and value-based care?
Yeah. So I think consent changes everything. So all of the traditional data models are institution centric, right? They are either serving, billing really between care providers and payers, but it's not people centric. With AcuVIA, with consent as its operating principles, patients decide, who gets access to what's shared, and for how long. And that creates trust. And trust creates richer data. And how do we know this? Well, there are multiple studies from Deloitte, Accenture, BMJ. They all show that when patients understand that sharing their data directly improves their care journey and their care experience, they increase consent by 70% and they share more. It's the transparency and the trust creates that. So with the model, with the patient consent, AcuVia really has a rich set of data that we're able to get from the consumer, which then feeds into some of our AI models like COPD, CKD, heart disease, and diabetes and hypertension. Now, again, it's with the consent. No, none of the
Mhm.
data is used without their consent. So if they consent, those models are run. If they consent, then the data is shared, right? So as individuals get more accustomed to how this works, we believe that, the data is going to get richer. And with that, they'll have the ability to share that data, that diverse, that identified or de-identified with, for research, for clinical trials, etc.
Mm.
But again, they'll have full control.
Yeah, and it sounds like just more data coming in, more things talking to kind of help what's going on, and then that's just sort of feeding that conversation and improving over time.
Yeah,
So it's
it's
better.
it's really creating collaboration between the patient and the provider, right? To
Yeah.
come up with the right diagnosis.
What's been the most surprising thing you've learned since moving from large enterprise roles into building your own health tech company?
Wow, there's so many things. So I think one of the things when you work for a large enterprise, right, you have the security, right, of lot less constraints, I would say, from a resource perspective when you're in a large enterprise. But then you have constraints like processes, right, and rigid ways of how you actually do something. But when you are a small enterprise or a startup, there is so much flexibility, but you have such limited resources that it just drives innovation because it has to, right? You're always trying to create a longer runway for everything. And it just forces you to also have clarity in what your mission is, what you're trying to accomplish. And I think you start to talk to a lot more people as well, because
Mm,
you want to make sure that the effort that you're putting in is bringing value. So I think
right.
that's one of the biggest things that has influenced, the difference between big and small and how I've changed, I guess.
Many founders would talk about balancing innovation with the realities of the healthcare system. So, what advice would you share for others navigating that?
Yeah. So healthcare is built on trust, right? And it's because it is people, and every little thing that you do impacts their lives. So it is filled with rules and regulations, right? And so when you innovate in an ecosystem that has those regulations and rules and has such vast human impact, you really have to be careful. I guess the biggest advice that you really need to understand it deeply. You really need to understand the incentives. You really need to understand the stakeholders, where they're coming from, because we know change management within healthcare, even if there's technology solutions available, don't always make it all the way through. Change management is very slow. And so everything that you roll out, you have to be cognizant that to drive adoption, you have to support many ways of doing things, many ways to be as inclusive as possible. And I think that is the only advice that I would give. It's like, don't try to break the workflow. Don't try to be so innovative and disruptive that no one adopts it. Try to make it work within existing workflows. Do
Mm,
smaller incremental improvements over time so you can drive adoption and then improve.
good. Yeah, no, I like that. So, thinking ahead, right? Okay.
Yes.
Okay, so when you look ahead 12 to 18 months, what's the vision for the platform?
So we're expanding from pilots to enterprise deployments, right? That's the vision. We also want to have a hybrid model where it's not just a B to B to C, but also a direct to consumer go to market, and to get the operational scale that supports this hybrid model. And we are raising funds right now to be able to accomplish that, but our vision is really to drastically improve our footprint, grow our footprint, not only with the clients but with partnerships, because again, we want there to be partners who we share the data with, right, if the consumer consents. And that is the vision.
All right. So lastly, tell us like how can people follow your journey or connect if they're interested in learning more about patient-driven data or potential
Yeah.
partnerships?
Yeah, so you can visit us on althea.com. You can also join our wait list if you're interested in the consumer launch. We also have LinkedIn presence, X, Instagram, and Facebook. Follow us. My X is at Althea CEO. Connect with me. And we would love to hear from patients, their own stories, because we want to learn and build this future together that works for everybody.
Love it. Thank you so much for this, Jolly.
Thank you.
Thanks for tuning in to this episode of the Wellness Growth Show. If today's conversation sparked something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.